All right, right now we want to bring in Dr. Susan Kaguchia. Dr. Susan Kaguchia is a public health specialist and a lecturer at JQuat. Doctor, it's great to speak to you this morning. If you can hear me, perhaps I'd love for us to quickly begin our conversation. As a health expert, what are your thoughts on how Kenyans, the indiscipline apparently of Kenyans and the activities that we're seeing given what's happening in the country?
Thank you, Lindsay, for having me on air. And I would like to highlight that in the quest of living right, we have option that to actually adhere to what we need to be doing so that we avert this COVID-19 disease. Now, this disease is highly contagious, and we all need concerted efforts to be in a position to make sure that we adapting to the new culture, because of course when such a disease that is highly contagious, then we all need a concerted effort to be in a position to avert the disease. Now, we need the Harambee spirit. I think this has been one of our biggest in Kenya, and we will only avert this disease by living right. Living right means that now that schools are closed, that universities are closed, and we are not to go to social places. We have to adhere strictly to that.
All right. And Doctor, even as a public health specialist, what happened is that with the announcement that even came from President Uhuru Kenyatta on Sunday, about 2 Sundays ago, we saw a panic coming from Kenyans. A lot of parents saying, I'm taking my children to the village. Is that a good move, Dr.?
Absolutely no, Zinzi, because now taking the children to the upcountry or going to the upcountry at the moment is only going to worsen the issue here, because we're all trying to work towards flattening the curve so that we stop seeing the rapid increase in the incidences of this COVID-19. And so going to the village is not only going to expose our older persons or those people who are already living there and they have other underlying diseases or conditions. It is also going now to even fuel the spread of this COVID-19 even further. And you will realize that the government has kept calling on everyone to make sure that we exercise social distancing. Now, closing the schools and being told to stay at home does not only mean that you stay at home, but you stay where you are at the point at which this outbreak came in. So we need to be in a position to make sure that we are reducing our movements and we are not taking the children to the village or the social places, because that is only going in the issue of COVID-19. Now, I want to, at this moment, to mention about shielding those people who are already old, because we those people who also have other underlying conditions. These are people who are highly at risk or they are more vulnerable to COVID-19. So if we start now going to the village, we are fueling the spread of this disease.
All right, and here's the thing, Dr. Susan, let's talk about grassroots and what can be done now, given that a number of Kenyans have actually dashed to the village. What can the government do right now when it comes to public sensitization, especially grassroots sensitization at the village, beyond the capital?
Lindsay, health education and promotion currently is the key thing here, and you will realize that government has really tried, and we have the social organized units at the village level, the community level. That is at the grassroots. We have government working through the community health volunteers or community health workers. These are the lowest people in health cadre, that is the level 1, that is the community where these people actually go door to door to even educate people on health matters. However, we are talking about not reducing the contact. So this using the chief and those local leaders is going to help. I mean, we have seen even the government bringing on board the police and the media, because the media reaches quite a big population. So right now, I am very sure many people are glued to their radios and TV, and I think this message reaching them even at the grassroots is really good to help us do the proper health education and promotion that is needed so that you can try and avert this disease. If you realize, Lindsay, we have very many people asking restrictions regarding this disease.
Yes.
But again, all we need is to adhere. We need to adhere to, the guidelines that the government is giving us, and these guidelines have proven to work elsewhere. And so I think it is important that we ensure that everyone is reached through those ways that I've mentioned.
Dr. Kaguchia, perhaps we could now talk about quarantine for special needs groups. These are the infants, pregnant women, children, the elderly. What does quarantine look like for those special groups?
Well, Zinzi, thank you. It is interesting because quarantine, when it comes to the law, the Public Health Act, Cap 242, really does not exonerate anyone from
right. And perhaps, Dr. could you paint for me an image of the difference between self-quarantine and government quarantine? Because a lot of that has come out in the past few days with governments such as Museveni's government saying if you do come into the country, you'll have to now self-quarantine at your own expense. As a health expert, as a public health expert, what's the difference between self-quarantine and government quarantine?
Self-quarantine is where you are expected to, if you're exposed, you have been exposed. In this COVID-19,
yes,
you're expected when you come into the country, you stay at home. And for 14 days, that is the incubation period that we are talking about since when you were exposed to this particular COVID-19. So it's supposed self-quarantining, you stay at your home and you're not interacting with other people. Now, what we have seen is that adherence level of self-quarantine has really not worked. And so this is continuing to fuel the spread of COVID-19 within our country. And so that is why government now has moved to the next best option, that is government quarantine, where now the law is very clear on making sure that the government provides facilities for people who are coming in or people who are suspected to have COVID-19 for them to be quarantined in government facilities. Now, currently, the government has given several facilities that are being used for quarantining. And if you're taken there, then you have to sit there for days until the government releases you after you have been tested and released back to the public.
Okay. Dr. Could you also help me understand how, if there's something that we've seen coming out a lot during this past few days with Kenyans being advised to stay at home, is the freedom of movement, human rights there, sort of clashing with a little bit there with public health law? Could you just touch on that?
Sure, Zinzi, and human rights. The right to freedom is a fundamental right.
Yes.
That is entrenched in our Constitution.
Yes.
Article 24. So, but this then has responsibilities. So this is together with the Cap 242, that is the Public Health Act, the section on notification of these infectious diseases and prevention and suppression of these infectious diseases then allows us as for public health to ensure that even if you have a right, we compel you to make sure that you quarantine or you are isolated, even if you're coming into the country, because if you've been exposed, then you will not fuel the spread of the disease. Remember, this is a highly contagious disease. So even when you have,
yes,
it is also important that we be responsible that if you know you have been exposed, then you are not exposing the general public to the disease.
All right, Dr. Kaguchia, today's show is giving special attention to how COVID-19 has impacted education. Before I let you go, shortly we're about to talk to a parent who has children with special needs, more specifically a child with attention deficit hyperactivity disorder. As a public health specialist with with majority of the children at home, what's your advice to parents who are dealing with special needs children? What should they do when it comes to learning for their children during this time?
And I think at this juncture, I would want to urge all the parents, as we said earlier, so that we try and flatten the curve and ensure that we are not fueling the increase of this disease or the incidences. We need to make sure that we keep our children at home. Now, at this point, of course, I want to agree with many people that education has become a big challenge. Because
yes,
now where we stopped, that is exactly where our children will go back to from, because again, our infrastructure is not very well developed. Because I don't know how many children can actually the gadgets so that they are able to do online learning. And again, but the government, I think at this moment, should be in a position to come up with, and I think their efforts to come up with sessions that are geared to now keeping the children glued to the TV so that they can learn. However, it's still a challenge. Now, when it comes to special needs children, it's even a bigger challenge, because remember, we are saying that we are not going to have the children at home and then get someone to teach them at home, because it's already exposing them too much. Therefore, for those students with special needs, the parents still need to keep them at home and have the best activities that they can do with them.
All right, beautiful. Dr. Ari, perhaps your closing comment, maybe around stigma?
Well, Zinzi, ideally, I would really want to start from comparing what is the situation out there in China and Italy, and the best lessons that you can actually learn from Singapore.
Yes.
Because time is of essence when it comes to averting any communicable disease, and in this case, COVID-19, that is spreading really like bushfire. Because remember, we have kept insisting on self-distancing or social distancing. Therefore, we can already learn from China and Italy that time is of essence, and speed, moving in with speed. If we are told to social distance and to make sure that we are hand washing or using sanitizer, then we need to strictly adhere to that. Without that, then, and of course, the concerted efforts of bringing each one on board to avert this disease, then we shall not be doing any justice to our country. Now, closing with the stigma, you realize that there's a lot of stigma that comes with any disease now, and at this particular time,
right.
the COVID-19, because
right.
we have seen cases where people are having the self-stigma and social stigma. Now, those people who are having the self-stigma, you find that they are not, they're actually stigmatizing themselves. And I mean, we've had cases of a woman who killed herself because she was isolated by the family, and she was told that she has the COVID-19, and she's announced her. So it is going to really impact on so much on people. Now, when it comes to social stigma, let everyone who, because we are all potential candidates to COVID-19. So it is important that you do not stigmatize the next person who is with you.
Right.
Just the best thing we can do is social support.
Yes.
Even when you are social distancing, call someone and tell them it's okay. I understand you had traveled. Please make sure that you adhere to these guidelines from government. I think to avert this COVID-19, we all need concerted efforts. Everybody needs to play their part, and also we also need to make sure that we are not stigmatizing those people who have already been tested positive or they have been quarantined.
All right. Thank you so much, Dr. Ari. That is none other than Dr. Susan Kaguchia. She is a public health expert as well as a lecturer at JKUAT, just letting us know some of the things that we can do at home, especially when it comes to special needs children during this tough time when it comes to learning. As you've heard, for her, time is of essence, and social distancing is something that should continue to be adhered to. Speaking of stigma, I want to take a quick commercial break. When I come back, I'll introduce you to Sylvia Mora. She is a parent who has allowed us a glimpse into her life, a parent who has kids with special needs, and she's the founder of Andy Speaks for Special Needs Persons Africa. We'll be speaking to her in just a little bit. Stick with Daybreak.